Hi, I'm Miranda. I'm going to tell you about HELLP Syndrome today. So, motherhood is a beautiful blessing, but this blessing can come with challenges. Childbirth is a very raw and emotional event, and some mothers experience very complicated births. HELLP syndrome is one of those medical phenomena that cause a complicated delivery. The mortality rate and morbidity rate of HELLP is 25%, and the infant mortality and morbidity rate is 6 to 10%. Nearly 48,000 women develop HELLP every year, according to the Preeclampsia Foundation. Thus far, researchers still do not know the etiology of HELLP syndrome, which means they still don't know how to prevent it. Symptoms can come on fast and strong, so treatment is urgent. It's a very life-threatening and complicated condition of pregnancy that puts both mother and baby at risk, and the way the baby needs to be delivered also affects postpartum. HELLP is thought to be linked to preeclampsia and proteinuria. However, a woman can develop HELLP without having either of these conditions, which makes it very difficult to diagnose. HELLP stands for hemolysis, elevated liver enzymes, and low platelet count. It is detected and diagnosed through blood tests. Hemolysis is the breakdown of red blood cells. Elevated liver enzymes are linked to liver failure and liver inflammation. And platelets are the clotting factor in blood, which means low counts are linked to hemorrhaging. Symptoms include right upper quadrant pain and tenderness from the inflamed liver, chest pain, headache, and vision changes. The only treatment of HELLP is the delivery of the baby, and it is often detected anywhere from 24 to 37 weeks gestation, which means it's going to be preterm delivery, and that is dangerous in itself. Preterm delivery puts both mother and baby at risk for many health complications, including respiratory failure, placental abruption, and renal failure. Delivery of the baby from a woman with HELLP syndrome is emergency C-section. This is different from a normal C-section because mom is completely induced under anesthesia, as opposed to a regular C-section where the mom is given an epidural and is awake during the procedure. When the diagnosis of HELLP is detected, medical staff moves quickly and efficiently to deliver the baby. The mother is immediately placed on magnesium sulfate through her IV. She must be on this before, during, and after the procedure. Magnesium prevents seizures in the mother and also promotes baby development. When a patient is on magnesium sulfate, they experience double vision, extreme hot flashes, nausea, vomiting, and their bodies feel very heavy. Therefore, they are not permitted to get out of bed for any reason, and a catheter is placed. Mom is bedridden for at least 24 hours after surgery while the magnesium is still flowing through the IV and she is recovering from anesthesia. Because of this, mother-baby bonding is taken from them, which is a huge factor in postpartum depression and breast milk production. After delivery, baby is taken to the NICU while mom recovers. Mom does not get to touch or see or hear her baby for an entire 24 hours after birth. The first 3 hours after birth are considered the golden hours. This is mother and baby's chance to bond and connect emotionally, mentally, and spiritually. This also is the time to attempt breastfeeding and promote milk production with skin-to-skin contact. Women with HELLP syndrome do not have this opportunity. This is a huge contributing factor with postpartum depression. Not only is mom trying to heal her body and process the trauma that she just went through, but she's also trying to handle her baby being in the NICU and having to be away from him. This often leads to feeling as if her body rejected her baby and forced it out of the room before it was ready. Seeing their baby in a box hooked up to wires and tubes brings back feelings of guilt, even though they did nothing wrong. According to studies, 1 in every 9 mothers experience postpartum depression. A recent study assessed 131 NICU moms and found that 16.1% had developed postpartum depression, making the rate much higher for NICU moms. Raising awareness for HELLP syndrome and educating women of the signs and symptoms can ensure timely treatment and prevent further risk and damage to both mother and baby. Preparation can also decrease or slow down the rate of postpartum depression in women who do experience it. Hosting discussions and events like this regarding the topic is the best form of awareness, and I hope we will continue researching and learning of the etiology of HELLP to aid in development of prevention.